second live session here from Ultra Sports Clinic. We're going to be taking some of your questions today and giving you some guidance. Please be aware that this is just guidance, and if you need some more specific advice, you can book an appointment with us. You can do that by calling us on 0203 893 5100, visiting our website at www.ultrasportsclinic.com, or emailing us at hello@ultrasportsclinic.com. Today we're going to be talking about sports massage. I'm Hannah. I'm one of the Sports and Remedial Massage therapists here at Ultra Sports. I've been here for 2 years. I have a long background in fitness and dance. I've worked with a variety of people, from elite sports teams to working at the London Marathon, and working with city workers as well.
And I'm Shaun. I've been a sports massage therapist for over 22 years. I've worked with professional athletes from Irish Rugby Team, Riverdance, professional footballers as well with the Irish, and professional martial arts people. I've been here at Ultra for just on a year now. This month is a year.
Fab. So we're going to take questions from you guys, so just send them in and we'll answer as many as we can. So we're just waiting for our first one to come through. So, I mean, a lot of the questions we get asked is what is sports massage? So it's the management, manipulation and rehabilitation of soft tissues of the body, including muscles, tendons, ligaments, and we utilise a variety of techniques to address muscular tension and any sort of areas of tightness, muscular imbalances, and any aches and pains that you might have, really. We've got our first question in. So Alex Dymo says, can sports massage help with my neck and shoulder pain? I get it mainly sitting at my desk. Sure.
Good question, Alex. We get that quite a lot, actually. A lot of our clients that come in actually have neck and shoulder pain from sitting at the desk, because we're here based in the city, so it's quite prominent. Basically, yes, sports massage can help with it. We find that a lot of it's not so much pain as such, but discomfort comes from being immobile, sitting in one spot for a long time as you're hunched over your computer. So yes, sports massage can help that. We would tailor it towards your actual issues, your condition, and hopefully we will do an assessment and make sure that there's no medical issues going on, there's no anything sinister, any red flags happening. And if that was the case, we would refer you on to one of our physios or one of the doctors.
Great, we've had our second one in as well. So JHXD17 says, who is a sports massage for? So in theory, a sports massage is a form of deep tissue massage. So it can be tailored to whatever is going on with your body. So you could be an elite sportsman or woman, you could be a office worker, you can be a weekend warrior, parent, chasing kids around all day. It's really for anyone that's got any aches and pains, or their body's feeling a bit tired, or any sort of muscle tension that's going on. So it would tailor it to your daily life. So in actuality, it's for everyone. Do you agree?
Exactly, that's exactly right, Hannah. Yes, there's a wide variety of different types of massage, but basically with the sports massage, we're more advanced in the techniques that we use. We tailor it towards your condition or your issue or your aches and pains that you may have. Relating back to the first question of can it help with my pain at my desk? Absolutely. Can it help with my hamstring pain from running half a mile? Absolutely. We can work with all of them. So yeah, it's basically for everyone.
Perfect. We're still waiting on our next question, so keep them coming in, guys. We'll get to as many as we can. I mean, what do you see a lot of people for in the clinic, Shaun? Is there anything in particular that you get?
I think probably our most common complaint would be the neck and shoulder issues. Lower back pain would be another one, or lower back issues. We do see, which is totally not sports related, but we do see pregnant women as well at various stages throughout the pregnancy. We see just normal people, I suppose, inverted commas. Different types. So it just depends on who we have come in. That's where we have to adapt our techniques.
Great, we've had our next question come in. This is again from Alex Dimo, thank you. He says he's got a running event coming up. How long before the event should he get a massage?
It's quite controversial. There's been I can't actually quote the paper, but there was an actual paper that said we can have it up to 24 hours before for an endurance event. It didn't help so much for a sprinter, but for long distance it seemed to help. But personally, from my experience, I would say if you want a deep tissue massage, no later than maybe, if your event was on a Saturday, no later than the Monday or Tuesday. If you want one closer up to the event, we would probably say no later than the Thursday, maybe the Friday, and then we would tailor it to you at that particular time, so it's going to be a lot softer, a lot lighter. But if there is an issue the day before, we can treat it through certain techniques that we can use. So yeah, I'd say 48 hours would be the most common, really.
Yeah, absolutely. We have another one in from Pasha Botha. I never know if I should have a sports massage or a physio session. What would you suggest? This is an interesting one because it really depends on what's going on. If you're unsure, first point of call would perhaps be a physio who will rule out anything underlying that might be an issue that perhaps we would not address. So, for example, a bursa issue or impingement, things along those lines are out of our remit. We would be addressing more the muscular tightness that would go along with those kind of things. Otherwise, if it's just a bit of an ache or a pain and you're not sure, come for a sports massage. We'll do a variety of tests and see if there is anything underlying, and we may refer you on to a physio if we think that's relevant.
I'm trained, got a degree in sports therapy, Hannah's doing a physio degree, and we both have experience in what we're doing, so we would run you through a full test to make sure that there's any neurological issues going on, any red flags that we could that would show up, and then we would definitely refer on to that. So we do have the experience to know when to actually refer on and when to treat, and what we can do and what we can't do in our treatments. Absolutely.
We've had another question from JHXD17. Is a sports massage painful? Good question. Everyone's pain tolerance is different, and we tailor our treatments to your personal pain levels. So I always say it should be no more than a 7 out of 10 on your personal pain scale. So 1 being no pain, feather touch, 10 being the worst pain you can imagine. It should be on the good pain boundary. So it's a little uncomfortable, it might be a little tender, but you're not holding your breath or screaming into the pillow. That's not what we're going for. So it should feel like it's, yes, a little bit uncomfortable, but it's doing something for you.
And just to add to that, Hannah, if you come in for a sports massage because you've got you're training for an event, but you felt a twinge, say in your hamstring, that particular area is possibly going to be painful just because of the condition that's happening or the issue that's happening on the area. The actual sports massage doesn't have to be painful per se, but the actual injury area, if it's an injury or a condition, that may be painful. So in that sense, yes, I think for that particular area.
Absolutely, I agree. 'Cause there may be some inflammation or
for sure.
Other issues going on with that muscle that we perhaps need to address that may be quite tender, but again, that's we'll only go with your pain tolerance. and we can feel it a lot of the time in the tissues, but also we will ask you for feedback on whether it's too painful. We can also see it in your face if you're laying on your back. So it's really very much dependent. Okay, great. We've got our next question in. So, how long between sports massage sessions, and what can I do in between to manage my aches and pains?
I'll do a little bit of that. And then
Go for
it. Personally, when I'm talking to my patients, when I'm talking to my clients about time frame, if you've got an event coming up and it's a couple of months down the track, you probably get away with having a treatment maybe once every 2 weeks. Once you start to increase your training load, then I would definitely recommend at least once weekly. We can work out any niggles or any issues that is happening. As you get closer to the event, you could probably drop it down a little bit to maybe once every 2 weeks, because you're going to be tapering as well. So we follow your training load. So once your training load is going up, we would recommend, or I would personally recommend anyway, at least once a week. And then as you're tapering into your event, you could drop it down maybe once every 2 weeks, and then get a treatment just before your actual event. And I find that works quite well with my patients.
Yeah. The other thing is, if you're coming in for muscular tightness, so we get a lot of office workers that have a lot of tension in the neck and the shoulders. And if it's your first time with us, we might recommend that you come and see us a little more regular at the beginning, so we can actually get your tissues into a nice state before we move on to, massages that are perhaps a month apart, and we're looking at maintenance at that point. So it really does depend on the condition of your tissues. The second part of that was, what can I do in between to manage my aches and pains? So there's a number of things. Stretching is always a very good thing, and not a thing people do enough of. There's also a number of tools you can use, so things like the therapy balls. So there's a couple of varieties. So you've got the spiky ones, we have the slightly softer ones, and we also have things like the cross balls, which are nice and firm. You can use these to do sort of trigger point release. Again, this is just guidance. If you need some advice on where specifically to use them for your condition, book in, and we can show you how to use them as part of your treatment.
You can also use what we call a stick. So this is a massage stick. There's also a foam roller, which I'm sure everyone knows of. Personally, I'm not a big fan of this. It causes a lot of pain, and in my opinion doesn't really do much except for compress the tissues. This, on the other hand, you can control how much pressure you put through. You can do it when you're seated, you don't have to be laying down, so you don't need a big space. Mainly for the legs, really, the calves and the quads, but it's quite practical, and I think it's quite good. I recommend this a lot.
We also have along that vein as well, we just had a question in from Tasha Buffer again. Should I use a roller for my tight ITB? Look at your posture. We perhaps do some muscle length tests, so look at quadriceps, hip flexors, back as well, and glutes and things like that. So we would look around the whole area, not just necessarily at the hip flexors. You might be experiencing tightness in those because you're compensating for perhaps elsewhere. And then based on that, we would make a treatment plan for what's going on with your body. So it might be that you actually just need a bit of a hip flexor release, and perhaps we need to adapt the stretch that you're doing, because there are a lot of different stretches out there. Some work for some people, some don't work for others, so it's just a case of finding the one that works for you.
Exactly. I do a lot of work on the hip flexor. I like to specialise in hips and neck, but with the hips, hip flexors can be influential in back pain and hip pain. Sometimes they don't affect at all, but I do a lot of work on that, and I do get good results from releasing the hip flexors. Physios can do them as well, and a lot of other therapists can do them. Personally, I would say come to a massage therapist, sports massage therapist first, and then we can refer one if it's out of our scope.
Great. I think we've answered this one already, but Jay Haggis 7 says, how often should I get a sports massage? As we said earlier, it really depends on what your activity load is like, and the condition of your muscles. but generally kind of once a month as an ongoing maintenance program will be really good for you, but we can discuss that on your first assessment.
Exactly.
Let's have a look, what else have we got next? I'm doing rehab post-knee surgery. Can sports massage help with this?
Absolutely. This is where we hone in, and it's more of a soft tissue treatment as such. It's not so much of a massage as people think of a massage as dare I say it, a rubbing technique. We would hone in, we'd use special techniques on this particular area. So was it a knee or was it a knee?
Yeah, knee.
Yeah, so it's a knee. So you're going to have swelling around the knee. So the sports massage with the soft tissue work can help with the swelling on the knee. We can also help with mobility because you are going to tighten around the surgical area or surgery area. In this case, your knee. What is also going to happen is chances are you're going to either be in some sort of a cast or a splint, and possibly using crutches as well. So, in a holistic sense, your non-injured side is going to become tight and sore from compensating because of your injured side. Whether you realise it or not, you will be compensating. You will be limping, or you will be depends on the seriousness, obviously, of the injury. So yes, we can help definitely in that with the injury itself and with the holistic part of it as well.
Great. Next question, Kate Elizabeth Hayes says, how important is sports massage and should I include it into my training routine? What do you think?
Absolutely. Absolutely. There's no doubt. It's extremely important, just for some of the things that we've answered.
Yeah.
To cover all that. All that's covered in a sports massage. Our knowledge is quite wide. Well, it's very wide actually in what we do. We're not just massage as such. We're highly skilled in what we do.
Yeah.
We've got a lot of experience. We're, as I say, we've both got degrees in the treatments itself. So we're well up on it. Absolutely, it should be for everyone's life actually, because it's a great way of just maintaining, keeping at a basic level, keeping your stress levels down, and more advanced level back to the injuries and back to your sports maintenance again.
And we put our bodies through a lot on a daily basis. So I mean, it's like your teeth. You know, you use your teeth daily. You go to a dentist regularly for checkups. You use your body daily. You come for a sports massage therapist for some maintenance. It should be the same thing. So yeah, absolutely include it in your routine. Okay, we have another question in. Abigail 62459 says, my mum has pain in her knee. What type of stretch would help? Again, this is a difficult one to answer without seeing your mum. We would need to look at kind of what pain she's getting in her knee, whereabouts is the pain, what is she doing when she gets the pain, and that will help us narrow down which muscles are part of the problem, if indeed they are the problem, and then we could help with guidance on stretches. So I would probably say for that one, it's worth getting your mum booked in for an appointment, and we can look a little bit further into it for you. Let's have a look, have we got any more? No, we've got time for a couple more questions, guys. If you want to ping them through, we'll get through as many as we can. So Abigail has replied saying 62459, sorry, walking down the stairs is the worst. Okay. So it helps a little bit. Can you tell us where the pain is? And that'll help us a little bit more. But again, we can assess her much better within the clinic, because stretching is great, but it might be also that she needs to do some strengthening alongside that to help with that. So we'd also look at things like her age and take that into consideration as well, because there's a number of other factors that could contribute to it. So yeah, best to get her booked in, and we can assess and refer on potentially if there's a need to.
It's quite a complicated joint.
Yeah, knee's very complicated, highly mobile, and there's a lot of muscles around it, so it can be quite a challenge to diagnose, especially without seeing someone.
Absolutely. And as you said earlier, Hannah, this is just a guidance as well. So there are a lot of variables, same as in any injury, any condition. There's a lot of variables that can come about. It could be just a an innocent hamstring strain that could lead into something more. So, an assessment is very, very important. I find I've even had a few patients that come in that have been to other therapists that have never had an assessment.
Yeah.
And it's just like they get onto the couch and they just start working away, and that can be very dangerous in the sense that you can definitely make an injury worse. So an assessment is very important.
Great. We've had another one just come through from Tasha Gota. When I'm having a sports massage, it sometimes hurts. Should it hurt? So we did talk about this a little bit earlier on, and that it will a little bit, yeah, but it's on that good pain barrier, and we will tailor it to your pain tolerance. So it really depends on what you like. Some people like they come in and want a good firm massage. Great, we'll do that for you. But yeah, we've had another one come through. It says, what is the best advice you could give me after a massage? Should I exercise or rest? Shaun?
If you've been having a treatment regularly, then I find some of my patients just go off and they do a run, they go to the gym, and they're fine with that, but they've been getting treatments regularly, so they're used to it, they understand you will probably feel a little bit lethargic, maybe a bit sort of bruised. Afterwards, I'd say definitely drink lots of water, because we are stimulating the body. Rest is another good day. So if you're doing it on your training, in your training regime, I would say have it on the evening of your day off, so that you can rest the next day and not do any exercise and get the full benefit of it. You could also probably do ice baths as well, would help, or cold showers, swim even.
Yeah. And you potentially, if there's a bit of muscular stiffness as well, potentially some heat application afterwards, but we'll guide you on that in the appointment as to your specific needs. We've had another one come through from Activate ORR again. On making an appointment for sports massage, do we book a 30 or 60 minute initially? Initially, 60 minutes is best, because we will spend a portion of the appointment having discussion about what's going on, what your background is, your lifestyle. We'll then do some physical examinations, and then that still gives us a good amount of time to do a nice treatment for you as well. So 60 minutes is best for your first one. We have another one come through from JHXD17. Why is sports massage and not a Swedish massage? Shaun?
Swedish massage is pretty much the basis of all massage, and they've developed from there. It's a basic, if you went to a spa, chances are you would get a Swedish massage. Techniques are very similar, but in ours we have more training, so we're trained more with injuries, so it's more specific to either a sports issue or an injury related. So in that sense, we're more trained in the actual sporting aspect of it, I suppose, and the injury aspects of it, as opposed to just the relaxation. That to me is the main sort of reason.
Yeah, I agree. We've had another question come through saying, I have pains, pins and needles. Can down my leg and sports massage help with this?
Very difficult, it can do, but initially you definitely need an assessment. The pins and needles is something to do with the nerve, whether it's been pinched, compromised somewhere along the line, whether it's a disc or whether it's just muscular or whether it's just irritation. Something is actually irritating that disc, producing that neural tingly sensation. So in that, it can help, but you definitely need an assessment first to work out where it's coming from.
Absolutely, and it may be that we decide that after that assessment, actually we're not the best people for you to see.
Exactly.
And we would perhaps refer you to a physio or potentially even a consultant if we do deem it necessary. But like Shaun says, we would need to see you and see what's going on and carry out that assessment before we can make a judgment on that one.
And that would go for tingly anywhere in the body as well, not just from your lower back down your leg. You could get it in your neck, going down your arm, into your head. So yeah, absolutely, you definitely need an assessment for that.
Great. We've got time for maybe one more question, guys. If you've got one, ping it through. Here we go. Do we offer treatment packages? Yes, absolutely. So we offer some for just sports massage exclusively, and we offer packages that include both sports massage and the other modalities in the clinic, so physio, chiro, biokinetics as well. For you can pick and choose which one works for you, basically, or we will help you with some guidance on that as well. So it might be that you're getting pain because there's a muscular weakness, so we might treat the pain and the compensation patterns and then send you to Nikki, our biokineticist, for some strengthening as well. Bear with me, we have another question come through. What type of trigger point ball should we use? Depends, it's personal preference, so there's a couple of varieties that we've got. There are some that are better for some things than others, so the peanut shaped ball is really good for releasing your back and having it either side of your spine, doing some breathing exercises if you're tight through your thoracic spine. Otherwise, you've got a variety of balls, so the lacrosse ball, which is really quite firm and can be quite painful. You've got some slightly softer balls, and then
soft ones.
Yeah, and we've got spiky balls as well. And they're just really personal preference, so it's what really works for you, to be honest.
Yeah, some body types, like the peanut ball, I highly recommend that for your back because your spine can fit in the middle and it targets the two muscles on either side. That's perfect. If you're going for an individual, say for your pec muscle or a specific, maybe your hamstring, you might want to use this in here up against the wall, or actually sit on this on your glutes. I would change to this because this one's painful. That's my own personal preference.
Fab. We've had one more question come through. Do you work with a chiro as well? Yes, we do. We have chiro in the clinic. We would refer to you for perhaps some adjustment if there's tightness in joints that we wouldn't address.
Yeah, absolutely. We all have our place, so definitely refer on.
Great. We have one last one. You showed us a stick roller. Why this roller, and where do I get one?
Okay, without advertising, you can get it on Amazon. Excuse me. We also sell them here at the clinic. So there's different types. Once again, the same, similar to the balls. This one's got actual foam on it. Other ones just have plastic or rubber on it, which is, once again, personal preference. What was the other part of the question?
Why this roller? In particular, why not a foam roller?
Right, personally for this, you have control over it. You can put how much pressure you want on it, on your calves and so on. So we do have these at the clinic as well.
Okay, that's all we've got time for today, guys. Thank you for tuning in.
Thank you.
Make sure you tune into our next session and get booked in for an appointment.